Okay, so welcome to this week's call. My name is Jackie Boyle, and as always, with Dr. Joseph Ahrens, it is an honour. And it really is a true honour to have Dr. Ahrens in the house and to be able to access his knowledge. He has a wealth of knowledge. He's had a few years around the sun, and through those years, he has had the award of being able to be, the pleasure, I should say, of earning his right to say he's a dual-nominated Nobel Prize scientist. And whilst I know he's very humble in it, and yes, he's shaking his head at me for bringing it up, but it is a true honour. And for us who have the access to your knowledge, it's something that you may take for granted, whereas we think that we're very, very fortunate to have that. And as a friend, for nearly 7 years, that I look at what I learned from you, I'm still learning. So having weeks like this of where we get Q&A, where people send in questions. So if you didn't get to send a question in, please put it in the chat and we'll try and get to that. So in saying that, Dr. Ahrens, how are you today in the sunny Bahamas?
I'm here doing okay. I look forward to these question and answer sessions because often I just talk about what I think we ought to talk about, but this is an opportunity for the audience to tell me what they want to talk about.
Yeah. Okay. I always think it's great because sometimes we get the same questions and we often think, well, they're the same questions, but they're for a different person. So it's good to try and answer what we can with people. So we'll kick it into gear. We've got a question here, Dr. Ahrens, that somebody's looking to see, with Emulin for conditions like, and we're not making any claims here either, so I do want to say that right from the top of this call. Anything that you hear here, we're not stating that we are claiming, curing or mitigating any diseases whatsoever. Dr. Ahrens is not your personal physician. He is merely providing you with his perspective and giving you his thoughts on how he feels about what the questions are. So if we're looking at Emulin M for chronic arthritis and inflammation, if we start looking at somebody that has a body weight of 110 pounds, roughly what would you think that they would be taking per day? Because they're looking at the volume of product that they would be taking on a monthly basis. Roughly what would you be thinking that they would be taking?
Well, 110 pounds on a basis, just maintenance basis, just maybe one capsule, one or two capsules maximum. But if they've got an issue they're trying to deal with and their body needs to kind of catch up, they ought to go to like 4 capsules. I wouldn't need to go to 6 or 10 because that's usually for someone who weighs twice as much as that. So 4 capsules until they feel they're under control, and then cut back. And if they say, oh, that symptoms coming back, then increase them, and you'll find that balance. Again, we're not treating a disease. It is supporting your body. It's your body that heals itself.
So part of this question also was talking about the cost of the product. So we do want to address this. We spoke about this too, Dr. Ahrens, and you said if I would weigh in on this, understanding what the cost is with the product through Valentis, that would vary. So my answer to that, which Dr. Ahrens asked me to weigh in on this particular question, cost of product would be depending on, you can get it as low as down to your $56 per bottle. It just US. It just depends on how much volume of product that you buy. So, and again, so just look at volume of product. So that if you're ordering one product, it's going to be more. If you're ordering 16 products, it's going to be less. And for me personally, I will say, can you afford not to? Invest time in your health before your health invests all of your time. So I want to thank you for that. So our second question, if we're looking at someone recommended asking you that their son has autism and he is 31 years of age and he is on medication for this condition, for his behaviour, they're just wanting to know, is there anything to help with the behaviours and the symptoms due to classic autism? What are your thoughts in this area?
Well, the cause of autism is varied. It's not yet pinned down, but we do know that a lot of systems in their body are really gone a little bit haywire. And it appears that Emulin helps your body. Again, it supports your body's function. And we have had people come on this forum here and talk about their own children that were autistic, they were on that scale, and it helped them manage tremendously. And that's important. It helped them manage those symptoms. So I wish I could come out and say, yeah, we just treat everything. I can tell you, though, we have parents that have reported that their children, not just adolescents, but older, had a very good lifestyle when they had Emulin, and either the C or the M.
Okay, so I can actually attain to that, Dr. Ahrens, because I know Dr. Ron Bosema would be the same. We've seen some amazing benefits with people that have utilized choosing to do this in that area. All right, the next question is, this particular person said they're trying to make sense of their medication. So I'm just going to say again, Dr. Ahrens is not your physician. He is merely giving you his opinion. And they're talking about their medications that they're taking. What do you do? What the side effects are. Needless to say, it's a confusing mess what they're doing. So can you tell us anything about the following, as they may or may not relate to supplements? So they're taking 4 different types of products, and they're wondering how that would interact with the supplements that they may choose to take or are taking in reference to Emulin. So beta blockers, ACE inhibitors, calcium channel blockers, coenzyme Q10 blockers as well.
This person is obviously suffering some heart issues, or either had a heart attack or getting ready to have a heart attack, and their doctor is trying to control their blood pressure and relax their blood vessels. So I really know how it can be hard to understand. You get a bunch of medications, but let me see here. You call the ACE inhibitors. So start with that one. So your body controls the pressure in your heart and your blood vessels by 2 or 3 means. One of them is to constrict the blood veins, and that gets everything rigid and the blood pressure goes up, and then to relax those veins and the blood pressure falls down. Also, it'll increase the volume of blood or decrease the volume of blood to try to keep the pressure where it thinks it should be. That homeostasis principle about it wakes up in the morning, it wants to stay even. And then because of events in our life, blood pressure can go too high or too low. Now, what happens on a ACE inhibitor is that that works on the system that causes the vessels to constrict chemically. So it relaxes those. It causes that action to not happen, and it just slows down and opens up those blood vessels, and the blood pressure will drop. So you stop that constriction, block it. And so then you're not prone to have a rigid blood vessel system. The other one, let's see, you said calcium channel blockers. That's one of the ways that the body increases blood pressure by having calcium go inside the vessels. Now, this is an electrical effect, an electromechanical effect, in that you put calcium or even potassium inside the cells, and they draw water in there following that calcium. The body always tries anything, a cup of water, tries to dilute whatever you put in there. So if you pump a bunch of calcium inside your tissue, water will flow in there after that to try to dilute it. And so that increases the pressure. So that particular drug stops the calcium from going inside. And that's actually why doctors will tell you, don't have so much salt, because the salt goes into your cells and the water goes in there trying to dilute it, and it raises your blood pressure. It's the same system. This just stops the calcium from going in there. So beta blockers was one of them you mentioned, I do believe. So in that case, when you get excited, you have epinephrine and it flows in your body, and your heart rate goes up, and your eyes pupils expand, your breathing increases, your heart starts pounding. Well, that's from epinephrine. And if you're having a heart condition, you don't want that to happen. You've heard me, he just scared me to death. Well, that's what we're talking about, a big shock. So those blockers stop that from happening. The epinephrine in there, it stops it from working so that you don't get that shock. So there are a couple of different ways of trying to lower that blood pressure by reducing the restriction and reducing the calcium going in, and then also to avoid that shock from any epinephrine. If they did get a fright, that it wouldn't be a jolt to the heart. Now, the coenzyme Q10, that's, I don't know if I exactly understand that question. I can tell you that coenzyme Q10 has been shown to lower blood pressure on itself, by itself, but the way it does it is unknown. Now, the main action of coenzyme Q is to regulate the energy in your body. Every cell has a little energy battery in it that's moving electrical charges back and forth, and coenzyme Q seems to regulate that, and it has a myriad of functions, but it's its main one. How it directly lowers blood pressure is not entirely known, and if anybody happens to know it, I'd be glad to find that out, but I think so far we don't know exactly the mode of action. Now, doctors will tell you, don't take a coenzyme Q if you're on other type of medication, because you're already on these medications that are lowering your blood pressure, and then CoQ comes in there and it'll lower it even further. That's the only real danger. You've got to use that CoQ as part of your regimen. So you need to talk to your doctor. Now, coenzyme Q is not a prescription drug, so you can get that over the counter. And so what you should avoid is taking too much medications and supplements that will lower your blood pressure. I'd like to add here that some of the products that are in Emulin, they help also lower your blood pressure. One of them, the quercetin, does it by helping the capillaries expand and get more flexible. And so you do need to worry. Yes, worry. Check what your blood pressure is. Don't just take a bunch of supplements, because a lot of natural supplements do lower your blood pressure. Grapefruit will do that too, by the way. It'll lower your blood pressure. So you need to monitor your blood pressure if you're already on these prescription drugs. And if you're going to take supplements, make sure that you take a little at a time and then increase slowly. It's not advice. I'm just what I know. And then see if your blood pressure drops too much, because that's what the fear is. It would drop too much, and then you wouldn't be getting enough oxygen in your brain, and that's the danger.
So Dr. Ahrens, I think you've actually really answered that extremely thoroughly. So it's given us a really good insight into these 4 medications that this person's speaking about, but you've also given the relationship to, which is my understanding of what this question was that they're wanting to know what the relationship was and the benefits of being able to utilize Emulin into the regime, which you've answered, I believe, with what some of the raw ingredients are in Emulin. So thank you for that. The next question that we have is in relationship to 24/7, the product itself. And it's just to clear up for people. So it's been sent in by a couple of people. But this particular one is that it's on the side of the bottle itself, when we look at this here, as opposed to what's on the website for Valentis. So when you go in to order the product and you've got the ingredients beside it, when you look on what's in the product on Valentis's website, as opposed to what's on the bottle, there is a difference between the two. So on the side of the bottle, has a different volume, as opposed to there's double on the website in the ingredients list itself. We've spoken about this, Dr. Ahrens, because I needed to understand it and said, did you know it was happening? And there's a very clear explanation as to why it's half on the bottle as opposed to being double on the website. Did you want to clear that up for people?
Well, first of all, 24/7 has always had caffeine in it from the very beginning. It's always been about what you would get in a couple of cups of coffee, about 99 milligrams from the very beginning. And on the bottles, it's listed as in caffeine, it's been 99 milligrams. And the bottle says the dose is 1 capsule. And 1 capsule contains 99 milligrams. Now on the site, from what I can see, the site actually said the dose is 2 capsules. And they put down the dose as 200 milligrams, which is, 198 versus 200. That's the same dose. They rounded it to 200, but that is the difference. If you decide if the dose is 1 or 2. Now, why is that confusing? It's because when I originally made this formula, I wanted the daytime formula to be 1 capsule around breakfast, 1 capsule around lunch. And then for the PM, I said, take 1 capsule before you eat dinner or at dinner, and then take the last one an hour or so before you retired. So yes, on the day formula, you're taking 2 capsules, breakfast and lunch. So that was interpreted by some people that put that web page together that the dose was 2 capsules. It's not, it's 1 capsule. 1 capsule contains 99 milligrams of caffeine. 2 capsules contains 198 or 200 milligrams of caffeine. And there's where the confusion lies. That is, and you'll see on that site, it does say the dose is 2 capsules. On the bottle, it says the dose is 1 capsule. Another reason that got confused is the difference in the US and Canadian systems. In the US, it is the per day, and in Canada, it's per capsule. So that they were trying to figure, okay, which we're going to use. So I have asked the powers that be to clear it up and make it the same for what's on the bottle and what's on the page, but they are saying the same thing. But yes, I don't want you to take 2 capsules at one time. I'd rather you have 1 capsule at breakfast and 1 capsule at lunch for the AM, and then for the PM, 1 about dinner time and 1 before you go to bed. So do you think that's clear?
I certainly do. Yes. Hopefully everybody else has too, which is where it has brought into that question that I didn't, and you've got the questions that this person had thought that the volume of caffeine had changed, but in actual fact it hasn't. It's just been that on the side of the bottle, it states that the content is for 1 capsule. On the website, it's saying that the dose is 2 capsules, so it's doubled what you're seeing. So yes, it has, Dr. Ahrens. Thank you so much. The next question, again, I'm just going to say, I know it sounds like we're looking at compliance, so we're not aiming to cure, heal, and or mitigate any condition here, because this is a touchy one, that when we look at this person is asking about an adult who has suffered with cancer and it has returned. So it went away with the use of cannabis, and this person did offer information about Emulin, flavonoids. And what should they start with? So it's returned. They haven't given us an age or anything, unfortunately. But just wanting to know, what should they start with, and what are your thoughts in that regards? There is a second part to this question, but I'll start on that one first.
Well, there's 2 parts to that answer. One of them is, first of all, everybody needs Emulin. I don't care if you've got cancer, heart attack, arthritis, anything like that, weight problems. That's not what it's about. It's about your body functioning properly. Everybody needs Emulin. If you don't have any disorders or diseases at all, take Emulin. You'll feel different. Your body will function better. Sugar metabolism is better. It'll be easier for your body to maintain all of its positive health attributes. So everyone needs Emulin. And we get those questions a lot. I have arthritis. And I said, well, I'm not here to cure arthritis. I'm here to support your body, and everybody needs their body supported. And the second part is, well, flavonoids have been shown to fight cancer. They have. I'm not making a claim that we fight cancer, but I'll tell you, flavonoids in scientific literature have been shown to reduce many different types of cancers. So with that said, take it. You need it. The only reason when you should not take Emulin is if you're on radiation treatment, because it protects you against radiation and could also conceivably protect the cancer cell from the radiation. So if you're going to go into radiation, get off the product a week ahead of time to make sure it's out of your body. It takes around 6 or 7 days to clear your body out and go through the radiation and get back on it. You'll heal better, you'll recover better. It supports your body in all of its functions.
Okay, thank you, Dr. Ahrens. And another part of that question was, this is somebody that's been using Emulin since you brought it out to the consumer. And there was a 9-day reset program that was attached at one point in time, which really, I feel from listening to this question, and I spoke to this person, that we're really looking at saturation doses themselves, to saturate your dose for a reset. Have you got any thoughts in regards to giving a suggested reset in saturation over a 5-day or a 7-day period? What you would suggest, just for general health, not for anything, just general health. We were looking at resetting and doing a saturation dose. What would that look like from you?
Well, I would take 2 capsules a day the first day, 4 capsules the next day, 6 capsules the next, 8 the next, and see if you can handle that. I can. When I first started it, back in 2007, when we had it in the laboratory, it didn't bother me at all. But I absolutely know people that have that rapid change like that. It can upset their stomach. And it's not actually you, it's the microflora inside your body that see this new food. It is a food, and they get all crazy. What is this? And they don't cooperate very well. And they can get a stomach ache. It might feel some esophageal burn. It is too much for them. So take 2, and you take 4. If you have trouble with 4, and look, you'll know it in just a couple of hours. All right, wait. Don't keep cranking it up. Just wait. Either go back to 2 for the next day, or try 4 again the next day, and you can come on gradually. But for me, I didn't have any problem. I wouldn't just start out taking 10 for sure, but I'd go 2, 4, 6, and then see how I did for a week or so. That's how I would approach saturation. Once that's over, drop down until you get on a maintenance dose.
So it would really, it's just to clarify that, Dr. Ahrens, like, it wouldn't hurt the body to, like, if you've been taking it for a long time, some of us have, to actually just give your body a bit of a extra support, I guess, really, to reset it, give a little bit extra support, and then go back, even just for general health and well-being. That's not going to hurt, is it?
No, it's not going to hurt. In fact, my normal daily dose is 3 capsules. I'm not a small guy. And but whenever I'm going to take a flight, and I know I'm going to be in around a lot of people, and this pandemic area, I just want to support my body, I'll jump up to 5 or 6. I'll double it the next day, 6, a day or 2 before I take these trips. It doesn't bother me at all. There's no problem. If you're already on it, you're already taking 3, yeah, you can double it to 6. But everybody I know doesn't need 10. There are a couple of people that still swear that 10 does them even better than 8, but I think we got a little placebo effect going on here. It would seem to me that 6 or 8, that's enough of saturation dose, then go back down.
Thank you. Okay, so the next question is, they're wondering if Emulin C would possibly help if a person had psoriasis of the nail bed. So we're looking at a symptom, not a condition, of course. They know that their daughter had severe problems with psoriasis, and the Emulin M she tried worked wonders, helped her symptoms greatly. Just seeing what your thoughts were in regards to assisting psoriasis in the nail beds, and is she on the right product?
Well, psoriasis is not a disease of the skin. Psoriasis can occur anywhere in the body. You just can't see it. It can be on your liver, your stomach, inside and out the intestines, and it often shows up on the exterior part of your body or under your nail beds, but that's not where the problem is. It can be anywhere in your body. So just in psoriasis in general, and that's treading on thin ice here. We're not curing psoriasis. What we're doing is supporting your body's immune system. And if you've got psoriasis, there's something wrong with your immune system. Yes, it is an autoimmune disease. And we're not attacking the disease. We're supporting your immune system. And it helps manage that immune system and manage the inflammation. And therefore, your body usually ends up not showing any symptoms. So yeah, it doesn't matter if it's on your skin, on your face, underneath your nail beds. It can be anywhere in and outside of your body. It's excellent. It works.
So in this particular person, and the second part of their question was that they are a type 1 diabetic. So your suggestion would be Emulin MC.
I usually have people that are concerned with blood sugar levels. I usually say use Emulin C. The only reason is because the quercetin in the Emulin causes sugar to come out of your fat tissue. It actually shrinks fat tissue. That's one of the reasons people lose weight when they take Emulin. And so you would see an increase in your blood sugar level. Now, it's really in the long term, it's not really important, because ultimately your blood sugar will be managed, and that little bump that you got just from the sugar coming out of your fat tissue, sugar and fatty acids, it shows a little bit of increased levels. So you're a type 1 or 2 diabetic, and you're sitting at 180 fasting blood glucose, and you take some Emulin, it might go up to 200, and you say, oh, this stuff's not working. It is working, and overall it'll reduce that background blood sugar level. Your body will, the Emulin won't cause it. And so this is why we say, you need to take Emulin C if you want to keep your blood sugar levels lower. Other than that, take Emulin M. You could take either one of them. They both work on inflammation. They both help manage blood sugar levels, but the C is more geared towards the blood sugar issue, and the Emulin M was geared more towards the immune system and inflammation. That's the only difference in them. Go ahead and take C.
Okay, thank you. I've got 2 more questions that have come through the chat. So again, we're not claiming to cure anything when I go forward with this question, because this has been asked that they know somebody that has asthma, they have had COVID, and they're now using oxygen to breathe. X-rays indicate interstitial lung disease. They've been put on steroids. Doctors are not sure how to treat it, and they're just asking as to what your thoughts are. And I'm just going to say this again, Dr. Ahrens is not your personal physician. This is just merely his own personal opinion here.
Yeah, that's right. I don't know all the total regimen they're on, but the problem with that, everything you described is all about inflammation. Asthma is inflammation. Where it's inflamed, the tissue swells, blocked all the little air channels inside the lungs. Steroids are there to try to shrink that down. And there is a place for these medicines. I am not an alternative medicine guy. I'm just a good health guy. And my loved ones have been on steroids whenever they're needed to help control that pressure, to just shrink the tissue. And so I know that Emulin will also do that. And it's a much healthier way to do it. But, stay on those steroids until you're out of danger. But Emulin will absolutely contribute to better health in this situation.
So it's going to support your health, isn't it?
Yes.
Support. Okay, so yes. So the last question that I have on here is that somebody has asked in the chat that can we take 24/7 AM PM, and they're talking about with the caffeine in it, with other coffees from Valentis?
Well, sure you can. Actually, when we first made 24/7, we were requested to make it that could be taken with the coffee or without the coffee. And we put as far as the US is concerned, we put illegal doses in there. And, if you're so caffeine insensitive that you can't take the amount of caffeine in 4 cups of coffee during a day, and you get the shakes from 4 cups of coffee, because that's about what it would be if you take the Valentis coffee and you take the AM side of 24/7. There's going to be about 3.5 cups of coffee, depending on how you measure it. And if that gives you the shakes, then don't take it. But I also say you could even take just one of those AMs. That will certainly help. And the PM has no caffeine in it whatsoever.
Okay, Dr. Ahrens, I want to say that is the end of our questions. So I do want to thank you so much. Is there anything that you would like to add to this before we wrap up today's call?
Well, I do really appreciate these calls. It gives me a chance to address people individually. I hope that I always try to be clear enough, because I start talking about acetaminophen's effect on the GAB pathway, and I can get carried away. I try to use regular English, and so sometimes hard to do. These are actually quite exciting things. That's what I do for a living. I'm a physiologist. I study the pathways in the body, particularly as they related to digestion, diabetes, and even Alzheimer's. So I do appreciate this question, but again, it's very difficult. I want to come out and say all these things that you'll be cured of. And so it's not. We are absolutely supporting the body. So, it's just like in a virus, we don't have anything to do with the virus, but if we can support your immune system, your body can handle itself. And that's one of the problems with some of these viruses is they overwhelm your immune system, or there's too much of a response, too much inflammation. So Emulin will help manage that part of it and keep your immune system in its top peak form. And so therefore your body can take care of itself. So just remember that we're not curing any diseases. I never want to hear that from anyone. We're supporting your body.
So Dr. Ahrens, I think Warren wanted to ask a quick question. Please try and stay compliant, Warren. So we try to do it through the chat so we can manage it. So be very careful, please.
Bone spurs, dosage male 60 on the feet.
Yeah, well, there's no direct evidence that flavonoids will reduce bone spurs. But absolutely, what happens? What is the problem with bone spurs? You've got nothing but inflammation going on there and wounding, self-wounding, internal wounding, and lots of inflammation. So I absolutely say that you should take this product in order to keep the side effects of the spurs themselves from forming. Now, there's a slight bit of information on the calcium metabolism that might help, but bone spurs are not because you have too much calcium in your body. It's so I don't want to make any claim about that. But just remember, I don't care if you got a bone spur or one right on the end of your nose here. You just take Emulin. Everybody needs it. Thank you.
Dr. Ahrens, I've got one more, I'm sorry, and this one's quite an interesting one. So if I can just encroach on your time, and I need Todd Atkins to unmute yourself, because can you please very, very briefly just ask Dr. Ahrens about your shoulder issue that you're wanting to ask, if you can.
Thank you, Jackie. Dr. Joe, I've got a torn tendon in my left shoulder and onset of osteoarthritis. Will the Emulin be able to help me manage the pain and the symptoms there?
Well, it will help a little bit with the pain, but mostly it absolutely will help rebuild cartilage and can repair tendon. There's plenty of scientific studies that say the major component of Emulin will do that. So, and then also, it's like wound repair. That's what's happened. You've been torn. And so now the big problem is inflammation. Your immune system is actually not just fighting bugs and viruses. It also fights splinters and thorns and your own torn tissue. The system comes in there and identifies all these chemicals that are given off from the torn cartilage, and then it sends in the troop to clean up the debris and repair it. And we have seen remarkable cases where that repair mechanism and the new scaffolding that goes between the new tissue is enhanced by using Emulin. So absolutely, it will help your wound healing faster. Maybe you've seen some of those pictures of people that had burns, and even people reported, I think we had someone say they healed, in half the time, 3 weeks instead of 6 weeks. Because of that wound repair, supporting your body's own system is critical for this to happen. So yes, and you will find out you may not need any surgery in the future. And we just help the body do its job.
Thank you so much.
And I think in Todd's case too, which you didn't mention, I've seen his reports. There's bursitis in there as well, which is an inflammatory response. So everything that Dr. Ahrens is telling you or sharing with you as a suggested, his opinion is only going to benefit. So I want to thank everybody on behalf of myself. As I said, I always feel very honoured to be able to bring this call to you with Dr. Ahrens, because we learn something all the time. Sometimes we hear things, but we don't listen. Sometimes somebody will show us something and we don't see it. not the first time, the second, the third, or the fourth. So it's always good to keep on having people bring up questions like this. And we truly do appreciate you doing that, because it helps us to understand and it helps others to be educated in what the possibilities are. And most importantly is to stay compliant. And this is where things have changed so much, especially in the US. What we could say before, we cannot say now. So you can see us dancing around questions in trying to answer them. Don't try and invent the wheel. Dr. Ahrens has a web page you can share. It's a safe zone to share with people. It's got an abundance of knowledge in there. There's 4 videos in there that you can use to explain what the product is. Valentis have now just put up a very brand new on the Valentis Share app. There is a video in there on Emulin, so you can share that. It's a safe place to be able to share. The information is out there for you to use, so try not to invent, but more importantly, invite people onto the call so they can be educated like we do each week. So on that note, Dr. Ahrens, I want to thank you so much from Aussie land to the beautiful Bahamas. I want to thank everybody for their time today, because it's really important to us that you do give up your time. Sorry, it's my phone. And you do join us. And next week, please stay on the call, because we've got a question. I have a question for you. So thank you so much, Dr. Ahrens. Do you want to send this call out for us by saying goodbye?
Thank you, Dr.
Well, goodbye. Goodbye. And I already made my closing speech, so long.
Okay. Bye, everybody. We'll see you next week.
Bye.